Mini facelifts. The word mini is a super challenging qualifier when we're talking about surgery. And it's because we use that word so differently across different practices, across different surgeons, and with different patients. So mini, in one sense, can refer to anything that's on the less invasive side of surgery, which I personally think is a little bit of an oxymoron. If you're having surgery, by definition, it's an invasive procedure and deserves all the attention and time and respect that it really should entail. But mini for some people can be a comforting word. So that's why we kind of have this inherent tension of, in our minds, we can rationalize it as, oh, I'm doing less. It's less invasive, it's less risk, etc. But on the other hand, it's still hyphenated. So it's still part of the same thing. In my mind, mini is best described by the actual surgeon that you're sitting down and talking to, right? Because we all have our own ways of approaching about it. For some, it's purely a marketing tactic. Kind of hate to lay it all out like that, but if they kind of talk to you about a mini lift and then you hear how extensive it's going to be, intuitively you're kind of like, what's making this smaller or mini than the full-blown thing? And the answer is probably not much. So the best thing to do is to always mention your concerns, sit down and have a real honest conversation about what you're willing to do or not do to address those concerns, and then really listen to the information that's being presented to see, hey, does this pass the test? If I think it's minimally invasive or less invasive, is that what I'm being proposed, or are we having a miscommunication? So kind of long-winded, but mini is a challenging word to define, and it's one that really is best suited out in the consultation room.